developmental of key service lines, the innovation and venture activities. Jonathan has over 15 years of healthcare strategy and operations experience gained across multiple health systems and consulting firms. He has a BA from the University of Pennsylvania and an MPA from NYU and an MS in finance from Baruch College. Jonathan, welcome. Dorcia Carrillo is the managing attorney for the law offices of Dorcia Carrillo PLLC. As the managing attorney of that office, she started her legal career at operating divisions of United Technologies Corporation, where she supported engineering and procurement by drafting technical assistance and manufacturing license agreements. Now, Dorcia combines business experience and legal skills to help companies negotiate technology transactions. And most importantly, Dorcia always wants people to know that she's an ardent supporter of the Alzheimer's Association. Dorcia, thank you for being with us today. Richard Hagerty is the CEO of the Hudson Gateway Association of Realtors, Inc., and the president of One Key MLS. The Gateway Association represents over 13,000 real estate professionals in New York City, Westchester, and the lower Hudson River region. He's also the president, as I said, and chief strategy growth officer of One Key MLS, a regional MLS that was launched earlier this year with the Long Island board, with over 40,000 listings from Montauk to Monticello. And Richard, thank you for being here. Peter Herrera, who is the president of New York Hospitality Group. He's a 36-year veteran of the hospitality and food industry and has held numerous positions, but obviously we all know him as being the proprietor of Sam's of Gedney Way. And when Peter made the choice to buy the legendary restaurant, it was really the foundational step towards what would become the New York Hospitality Group that now is comprised of 4 divisions: Sam's of Gedney Way, the Great American Barbecue Company, Carpentry Catering and Events, and the Everyday Health Cafe. Peter, thanks for being with us. Sarah Jones-Matero is the president of RM Friedland. Sarah, RM Friedland is the largest commercial real estate brokerage company in Westchester County. And since joining RM Friedland in 2015, she has led a successful rebranding of the company. And she started an investment sales division with some of the region's market leading brokers, and most recently started an office division, which is now being led by one of the more prominent brokers in Westchester County. Sarah, thank you for being here with us. Liz Pollock is the senior manager in marketing of Mark Realty. Liz, in this capacity at Mark Realty at Cross County Centers in Yonkers. She's been there for the past 12 years. She has overseen retailer relations, advertising, and public relations, as well as business development, special events, digital marketing, which includes social media. Liz sits on the board of the New York, New Jersey Council of Shopping Centers, Yonkers Chamber of Commerce, and she earned a Certified Marketing Director designation from the International Council of Shopping Centers. And finally, Mayor Andre Rainey, who is the mayor of the city of Peekskill. As the 23rd mayor of that city, Andre will continue bringing fresh perspective to entrepreneurship, innovation, community engagement, collaboration, and partnership. By understanding the desired roles of government in the lives of the millennial generation and the noodle overall, Andre is a man with many talents that does not hesitate to show and share, whether through music, politics, or just walking down the streets. He carries himself gracefully with love, respect, and the determination for creating a better world, starting with the city of Peekskill. Mayor Rainey, thank you for joining us. Thank our entire panel. I told them at the beginning that we're going to mix this up and we're going to be asking each questions, but if they want to weigh in on one of the topics that one of their co-panelists is doing, please feel free to do so. For those of you who are watching, we're also doing this, broadcasting this live on Facebook Live, and a recording of this program will also live at the BCW's Resource Center. Jonathan, I'm going to start with you just because, as I mentioned, every industry certainly has been hit hard by the pandemic, but the healthcare industry is obviously on the front lines. Talk to us about what you experienced in February going into March and how you and your team were able to, if you can, even prepare yourself for what you all faced over these last few months.
Yeah, thank you. I appreciate that. You know, it was certainly a time unlike any other that we've experienced in my career and lifetime. And, you know, unfortunately, we're starting to see some similarities now for what we saw early on in February, March timeline. Not quite as bad yet, and hopefully it never gets back to that level. But we're definitely seeing an uptick in COVID activity. So, you know, healthcare is an interesting industry because we only control so much of it and we're heavily regulated. And there were a multitude of factors that impacted our day-to-day operations, starting with our ambulatory physician practice network, where we essentially had to shut down because A, patients didn't feel safe going to the offices. B, we needed to redeploy personnel back to the hospital where our systems really were taxed. And so we immediately pivoted. Fortunately, we'd already put together a business continuity plan, not anticipating a scenario like this, but anticipating some level of disruption in in-person care. So we were able to pivot and really accelerate our digital health strategy. We were able to train close to 300 providers on our virtual health platform in a matter of 10 days, and then truly took our entire ambulatory network digital, which helped from a, again, business continuity standpoint, but also from continued access to high quality services that our patient population depends on us for. And like I mentioned, the secondary benefit of that was redeployment of personnel from those offices that were closed to the hospital, where we needed all hands on deck, all the bodies that we could get as we were trying to manage that COVID surge that we saw. I think the team did an incredible job. Our frontline healthcare workers, everyone from nurses, physicians to environmental service staff, everyone did a phenomenal job given the circumstances. And we learned a lot from it and are better prepared this go around. And we continue to iterate and learn as we go. But I hope to never see what we saw in March and April ever again for the duration of my career. And yeah, I mean, I'm just thankful that we came out sort of where we are now in a better place.
Well, again, I think I speak for everyone who's tuning in this afternoon. Thank you for your service, and thank you for the men and women who have worked at White Plains Hospital, as well as all of our healthcare systems. Sarah Jones-Montero, what's your gut feeling now? I mean, in terms of how long do you think it's going to take for your industry to bounce back, as well as looking at some sort of normalcy moving into 2021?
I think I want to couch this by saying I am, some would say, a delusional optimist. So maybe handicap it by 6 to 9 months. But I think optimistically, I think by summer of 2021, in terms of like a return to experiential retail, which hopefully we'll talk about later, in terms of people returning to the office. But I think it's going to be a new normal because I think remote work is here to stay. So I think we're just going to kind of have to evolve. But I think, you know, by June, July of 2021, things are going to be somewhat normal again.
And Richard Hagerty, I'll ask you, because obviously, as we talked about the number of realtors that you have in your organization, what are they hearing? What are they seeing? I mean, obviously, for the first few months, they couldn't be actually in person showing folks homes. Or what's changed? What do you think you're going to see for 2021?
So what's changed is everybody is on a grand exodus out of New York City. If you were to ask me in April or May, would we be recovering in the residential resale area? I would have said, if we get back to being flat or just a single digit numbers, I'd be happy. That didn't happen. We came roaring back. We had a strong first quarter. We had a 22% drop in single family homes in the second quarter, because not only could agents not show properties, you really couldn't do in-person closings. So the attorneys, even with properties that were in contract, you couldn't do the closings. But when agents were able to show properties in June, the market took off, and quite frankly, in a way that surprised me. We've now totally recovered from that dip in the second quarter. And it looks like if you're looking solely at single family homes, we'll be about 10% above last year. So it's been remarkable, the rebound that's occurred in the third and fourth quarters of this year. So it's just, what's going to be interesting is if it's sustainable, and I think we'll talk a little bit about that. But in terms of the recovery on the residential side, it's actually surprised me, quite frankly.
I just want to add to that too, because obviously we're a commercial group, but what we do sell are, you know, residential development sites. And what we've seen is a tremendous demand for our suburban residential development sites in places like Hastings on Hudson and Pleasantville, and not, you know, transit-oriented locations. And from urban developers, from developers that historically only looked in urban areas. So I think that's been sort of a really interesting trend that we've seen come out of COVID.
And quite frankly, I think that, Sarah, for the recovery to continue, it's going to be based on your optimism. If we see that bounce in the middle of 2021, I think it's sustainable. If we don't see that bounce, that could be challenging.
Right.
Hey, we've seen it on the ground too at Cross County Shopping Center. You know, typically customers tend to shop within 5 to 7 miles of where they work and where they live. But we have seen more customers from the boroughs, from Brooklyn, we interviewed somebody on Black Friday weekend who drove up from Rockaway. You know, I mean, you're doing here from Rockaway, but it's great. They came because it's an outdoor environment and they have more confidence shopping in an outdoor environment. But more than ever, we're seeing more and more people from Brooklyn, from even New Jersey and Connecticut coming in too.
So Liz, let me ask you about Black Friday. I mean, obviously that has always been a day where people set their alarms early or don't even go to sleep and get to their. What were you expecting, or did you have any expectations? How did you prepare for what obviously would be a different type of Black Friday at Cross County?
Yeah, it certainly was different. This is the first Thanksgiving I didn't have to work in about 10 years. So I'll say that was my one benefit. But it was different in the fact that a lot of retailers didn't open on Thanksgiving. So those retailers who do big numbers that day lost that day essentially of sales. And then on Friday, there was no mad rush. You know, there was no sense of urgency to get in and get a doorbuster. That doesn't exist anymore. So now it was slow and steady, but it was steady. It was busy throughout the day on Friday and Saturday. I mean, we had the most perfect Black Friday weekend weather you could have asked for, you know, to encourage people to get out, but it was slow and steady. And I think, you know, that wins the race.
That's great. Dorcia, let me turn to some of the things that you're seeing within your industry. I mean, obviously, things are changing. Regulations have to change. What are some of the things that you're looking at? What are some of the things you're talking to your clients about that they're going to have to be on the lookout for?
Absolutely. So with people working remotely, and as someone mentioned earlier, that's likely not going away. People who can do their jobs offsite and who enjoy doing their jobs offsite are probably going to want to continue to have that benefit. And with that benefit comes the risk of cybersecurity. So of course, it's important for corporations to make sure that they have policies in place for device usage and that there's training so that their employees understand what the risks are and how to manage those. So I've seen a lot of focus on building up strong cybersecurity, making sure that employees are properly trained and understand the risk, and then just doing spot checks, you know, having those sort of phishing tests and that sort of thing to see what the population in the company is prepared to, how they're prepared to respond.
It's a great point.
Thank you for that. Mayor Rainey, obviously your role is a little different because not only
just a little
bit. Not only are you responsible for the residents that live in the city, but also for the businesses that are there too. Yeah. It was. I'm sure this has been almost like a baptism by fire for you. Talk to us a little bit about, again, you and your team, what you needed to do, and what are some of the things that have worked to move your city forward.
Absolutely. Well, first, I want to say thank you to everybody that's on this call, because in government we rely on collaborations with creative thinkers like yourself. So you all make it a lot easier for us to get things accomplished. I will say, you know, you mentioned being responsible for the residents. I almost feel like I'm responsible for COVID sometimes when you talk about what's happening and what people want to see done, because we're the, you know, in my position, we're the ones that have to relay the message and create the policy for the safety of the people, despite what people want to see done or what they want to hear. You know, we're the ones that have to contact the local businesses and say, hey, listen, because of what's going on, you have to shut down, or because of what's going on, you have to, you know, limit the amount of people that you serve, or the amount of people that patronize your actual restaurant or business, or whatever the situation is, whatever type of business it is. So we're in most cases we're looked at as the bad guy, and unfortunately that comes with the territory of this business as an elected official. Sometimes being the bad guy is being the good guy at the same time, and hopefully later on down the line people actually recognize and remember that. But you know, we've had to shut down parks in our city, and we're one of those river towns where people love the park. I mean, prior to COVID and after COVID, people go to our riverfront and hang out. You know, we have one of the longest trailways in the county. It's about 3.5 miles long. And it's just alongside the river. So people love to go there. So, you know, before this COVID hit us, that was one of the main places that people came to visit when they came to the city of Peekskill. And now that everything is being shut down or limited, you see a lot more people there, you know. So it's been a challenge, but we've been able to work with the local businesses, you know, work with the school district, and just try to keep everything safe for our community. And the important thing about what we do is the messaging, you know, making sure that we reach everybody, you know. Is the message clear to all the businesses and every business? Because if one business has to close, you have to have an explanation why this business doesn't have to close, or if this real estate, sorry, I hit the mute button. If the real estate office is open, or, you know, why doesn't the insurance office have to close? Like, there's so many stipulations to what we do and how we get the message across. And to remind people, it's all about the safety. You know, COVID, you know, I heard somebody say earlier, like, you know, this was unforeseen. This is nothing that we could have planned for or prepared for. We didn't expect it to happen, but you know, quick thinking is the only way to survive now. And in my position, the idea is to make sure that everybody's on the same page in the entire city, in the entire community. So it's definitely been a challenge, but again, that communication with the local businesses, that communication with the school district and the faith leaders and so on and so forth, that's played an important role in keeping us a little bit above the water.
That's great. The city's lucky to have you as their leader during this tough time. Peter Herrera, for full disclosure for everybody who's watching today, my family and I did not eat outside of our kitchen in our dining room for about 10 weeks. Our first meal outside of our house was on a Wednesday night at Sam's of Getney Way when you opened up your backdoor dining, and it was a major relief for us to be able to do something normal. So thank you for that. But obviously, the hospitality industry has been affected so dramatically by this. Talk to us a little bit about, again, what you had to do to keep afloat and what issues you're still facing getting out of 2020 going into 2021.
Thank you, John. As so many have put it, we're in the crosshairs. We really are. Right behind the virus are restaurant, taverns, any place where you can gather. As so many have said, our president, our governor, stay out of restaurants. It's been challenging. To say that we used to plan quarter by quarter, year by year, we were planning day by day, week by week, and I've never seen so many changes from there's a virus out, you know, you're gonna have to be careful to next week you shut down today. The day before St. Patrick's Day is a big day for our industry. Everybody bought all the beer, prepped all the food. Is it gonna, you know, it's the start of spring for us. And we got shut down. So we were shut down till, and the hard part was not knowing, and I'm not, but not knowing what being safe meant. Is it a covering, or is it a natural and as organic and inorganic layer on your face covering? The face covering changed, the space changed, everything was changing week by week. We were fortunate because we have an organic, a pseudo-organic cafe in White Plains Hospital. They were a great strategic partner for us, and they were great. A lot of times they said, just go to the CDC. I was on the CDC website every morning to see what the next protocol was and what the next safety was, because there was so much information out there, which is great, but when it's not all the same, it's very, very challenging. We learned, this is our fourth recession since 1986. So we did learn, not a popular decision. It took us 35 years to get to 100 staff members. It took me 35 days to get down to 15. And we've only hired 20 back. So the hospitality industry has been severely affected. We were fortunate that we are a hospitality company, and we reached out to all our clients. What did they need? How can we help? Forget about the budget, forget about the costs. And we have some great vendors. Lent trailer, so we could help out with hospitals that we're doing a divide and conquer kind of we were handling, the hospital was handling patients for a couple hospitals in the area. New York Presbyterian in White Plains and New York Presbyterian up in Cortlandt Manor. We're struggling. Our industry doesn't know what it's going to look like in 3 months and 6 months. Excuse the expression, it's like we're on an induced coma. The PPP loans, if you were lucky, and you had a good relationship bank and a local bank. We have a local bank that.
Peter, I think you're coming in and out a little, so we're gonna hopefully get you back on in a second.
I want
Folks,
to add to something that Peter
please,
was saying. So
please.
the point he was making about checking the CDC every day, that's going to be critical for all businesses going forward to make sure you have a compliance program in place. Whether you're bringing employees back on site, there are going to be special regulations you need to make sure that you're following and adhering to, and just making sure you have the process and the right people as well, because you want to make sure that everyone within your organization understands what the requirements are, whether you're in food service or whether you're in real estate, manufacturing, whatever it is. So compliance is going to be critical, and I'd be interested to hear what Mayor Rainey has to say as far as the local government resources, because as Peter mentioned, you know, the regulations change. You don't know which, some of them are different from federal to state to city, all of those things. And so it is a challenge, compliance of any nature. You're never going to reach 100% if you're in business, but you are always striving to be as compliant as possible. And one of the ways to do that is to be able to partner with government officials where that's, you know, where that's likely, because pardon, sometimes there is a fear of going to government because you might be doing something wrong and get in trouble. But the point I want to make is that it's better to practice trying to be compliant rather than getting hit with an enforcement action later on.
Yeah, and
so Mayor Rainey, go ahead.
Yeah, and I'm glad you said that, you know, because the compliance part is a part that we have to make sure that we we convey it to the way that the businesses understand that this is not a target. You know, you're not a target that the government dislikes you for any reason. You know, it's a matter of safety. And what we try to do, you know, we have the governor's executive orders that kind of like overshadows anything that we want to do for the most part. So we try to be creative under, you know, what the executive orders tend to be. And I'll give you a prime example. There's a small restaurant in the city of Peekskill. During the first wave of the COVID virus, one of the early executive orders had closed down restaurants and local businesses, but Walmart, for example, was allowed to stay open, and Home Depot was allowed to stay open. So this small business is like a small Walmart. It's very, very small, but they have like a variety of things in their store. And she was complaining, like, why would you make me shut down but leave Walmart open when I sell the same things? And it's like, we have to remind people that the safety is the main reason. But if there's safety measures that they can take to try to keep it safe, then, we as a government, we try to work with the people. We in the city of Peekskill, we closed off a lot of our streets that are not normally closed off, and put barriers on the streets so people wouldn't drive in them, to allow the restaurants to open up outside of their restaurant, which will give them, still give them business. Normally we charge a permit fee and insurance fee and everything. We waive the majority of all of those, if not all of those, for businesses, just to try to show our support for the businesses. But however, if we find out that a business isn't following safety measures or protocol, then that's when we have to give our strong arm. We have to have our building inspector come and shut down, and at the same time, the businesses are what we want to support, because that's what makes the economy thrive. And we realize that. Everybody, at least hopefully every elected official, realizes the importance of supporting your local businesses as often and as much as you possibly can. But again, reminding people the importance of the safety aspect of something like COVID is the message that we have to drill before anything. And again, we try our best to work with the local businesses. Some of them they've set up windows in their businesses now, and they require masks when you come in their business. They check your temperature when you come in. They're doing everything they can, so we're doing the best we can to work with them and let them stay open.
Well, I want to get to confidence for all of your different clients and customers in a moment, but I want to talk about something else. And again, this is open to everybody. Communication. communication within your organization during a crisis. And I know that for us, Marsha Gordon and Heidi Davidson, from day one, we said we were going to be in communication multiple times a day, even though we weren't together, because we needed to be on the same page all the time, dealing with things that were coming out of left field. And that, I think, has made us a stronger organization. Talk to us a little bit about all of you with different industries, different numbers of employees, spread out all over in a crisis. What were your priorities in terms of how you were going to communicate with your own people? And I'll throw that open to anybody and everybody.
All right, I'll jump at it. In our position, obviously the ultimate goal is you have to try to reach as many of the people in your community as you possibly can. It doesn't just stop at the people that work with us and for us as elected officials. So, we've gone all out by doing press conferences. Me and the city manager, we do a daily or a weekly briefing update of how the city is doing with COVID cases, what our next steps are for the following week, and how we're going to try to prevent cases in our city. We've given out thousands of masks and sanitizer. And one of the challenging parts that I would say is if you don't reach people in this industry, if they haven't seen it, or if they haven't been able to watch the video or hear the updates, and in these people's minds, if they don't see it, it didn't happen. So you realize, you're in a city with 28 to 35,000 people, and you post an informal video up on your city website, your government channel, YouTube, Facebook, everywhere, and it only has 3,000 views. That means there's about 25,000 people that haven't even seen anything that we're talking about. So the idea is, how do you be creative and reach them? So what we found out really works for us is working with the stakeholders in the city, working with the businesses in the city, working with the leaders of the city, working with the school district of the city. And it's coincident, as funny as this may sound, just putting up signs. People drive through the city, they're walking in the parks, they're hanging out by the basketball court or the soccer field, just seeing signs. It helps convey the message subconsciously, which is, I think, has been effective for us. But again, making sure that that same message is consistent. People want to see it as often as possible. Even if it's the same information, they want to see it all the time. So that's been I guess, helped us out a little bit with the success and making sure that we reach the people.
From marketing, we always wonder if people ever read our signs. Do you ever see?
Yes, they do. We do a Peace Scale for sure.
They do. And from our perspective, we had a lot of different audiences to reach, I'll say. We have over 100 retailers here at Cross County Shopping Center. We have our own internal employee base of 50 or 60 people. We have 11 million visitors who come to the center every year. We have different groups that we had to reach in different ways. But I think you're absolutely right, Mayor, when you say, consistency of your communication, of your key messages and your speaking points is really important. One of the things that we found helpful from our internal perspective with our own employees was to have one person in charge of communication. And for small businesses, kind of what you were saying earlier about compliance, if you don't know where you're looking or you don't know who to ask, it gets a little confusing. And a lot of small businesses don't have a compliance officer or somebody like that. So to put somebody in charge of communications, making sure all the employees know when they can come back to work, what they have to do, we found that really helpful was to have, one person that you can go to.
Absolutely.
Yeah, I think, another interesting thing is, there's critical communication and then there's positive communication. And what, we definitely did our best to communicate about the critical things that were happening. But I think when we were in lockdown, right, from mid-March until June, so much, and when we were all, working remotely, everyone's sort of sitting on their own island. One of the things that we sort of struggled with was, how do we positively communicate with people? And what I did for a while, for a few Fridays in a row, was I would send out an email, weekly wins, just with some positive things that happened that week, deals that had closed, exclusives that had been won, how our marketing platform was doing. And I think maybe it made a little bit of a difference, but it was a way for us all to kind of feel connected, and maybe things weren't so bad. So I think that's an important piece of it too.
And I want to piggyback on what Sarah said as well. I think here at the hospital, you actually stole my speaking points that I had jotted down in terms of my notes. It was that positive reinforcement. And here at the hospital, we had visual cues. So to Mayor Rainey's point about signs working, for the frontline staff that were living this hell day to day, you know, all the thank you letters that we got to the hospital, we laminated some, we hung them in the lobby, we had signs all over the hospital, you're appreciated, we thank you. And I think that helped some of our staff get through the days, honestly, that were really long days, that were really difficult days. And in terms of the critical communication, our CEO, Susan Fox, did a phenomenal job communicating to all levels of the organization multiple times per day. She continues to provide updates. So that way we are all aligned with a similar message. And similar to what Mayor Rainey said earlier as well, it's about the messaging about safety first. You know, we have to make unpopular decisions, particularly as it comes to visitation at the hospital for family members, you know, in March, April, May, where we couldn't have any other bodies in the hospital. And how do you communicate that to a family member who may have someone in the hospital that they're worried about, and coming up with creative solutions to encourage and enable communication, but also, again, emphasizing this is about your safety and your family member safety as well. And I think we did as effective as a job as you could have given the circumstances at that time. But I do think that, as Sarah mentioned, the positive messages are critical just to maintaining some semblance of mental health normalcy for sure.
Absolutely. I just want to add one thing to that. What Sarah said has been vital to the community. You know, with the new generation, you know, social media technology is like pretty much taking over. I remember when I graduated high school, when I went to college, you had to have a college email address in order to have a Facebook page. You know, now Facebook is for anyone and everyone. So, you know, consistent messaging on Facebook allows me to reach more people than I think anybody prior to 2000 could have even possibly dreamed of reaching with certain messages. So we encourage, you know, we have two hospitals here. We have the Hudson River Healthcare Center, which is now Sun River Healthcare. We have New York Presbyterian Hospital here. And, you know, we encourage people all of the time, send letters to the actual hospital. At the same time, you know, take pictures and share them with your colleagues. Let people know the stories of some of these doctors and nurses that are working in this hospital that's right here in our backyard, and see how they feel. So you don't have to take my word for it. If you think it's a conspiracy, if you think it's political that we're making you wear these masks, listen to some of these nurses and doctors. And some of the nurses have sent little videos to me, and I put them on my public figure Facebook page. I put them on the city website, just so people can understand that this is not a joke. You know, it is extremely serious. But getting that message out and using the platforms of social media and technology has been a benefit to all of us.
So, go ahead, Richard. Yeah, go ahead, Richard.
John, if I may, it's funny. I've dealt with a lot of your organizations, the other panelists, and our team. We divided kind of and conquered our event staff. There still are no events. So we had our own personal Zoom just to keep people's morale going and what was going on, because it was a very difficult period when it came to what does the PPP loan mean? Right. When can I get unemployment insurance? What does that mean? So we divided and conquered, but I just wanted to comment on Jonathan to White Plains Hospital. They were incredible. We reached out to them because we have organic cafes in their lobbies. How can we help? Their HR department was so open that said, you know, we want to do something for everybody walking in. I don't know if you were in the other building, Jonathan, but Dawn French turned around and goes, what can we do? We proposed to the HR department, why don't you do a kindness for caretakers? At 7 o'clock in the morning, we handed out 1,500 kind bars and coffee coupons for the staff. And when people wanted to help the hospital, they could buy a couple out for $500 or $1,000. They could buy everybody in the hospital for 2 hours a cup of coffee. The lines that we had were hysterical.
That's awesome.
But it was, you'd be surprised that communications is so different for everybody. We had meetings with our staff because we were making almost 2,000 breakfast, lunch, and dinners every day for 6 weeks for 3 local hospitals. You wouldn't believe where we had a problem, everybody. Everybody understood the mask. They understood the 6 feet. If you were caught, everybody got a bottle of wine on Friday if you stayed away from each other. If you got 3 strikes, meaning, you know, Mayor, you're standing too close to the guy next to you. Okay, strike 1. It's funny, but it was a game that we had to play, so everybody took it serious. You wouldn't believe everybody where we had a problem. Remember, we're in the hospitality industries. There's brothers, mothers, fathers. We all work together. When we had lunch together, everybody would take off their mask. And on the first day, I panicked. We had 40 people working with their masks off, eating all at the same table.
We won't tell anybody, we promise.
No,
Richard,
but
I know you want.
everybody looked at each other, goes, what do you mean? We're eating together. I said, this is a pandemic. It was, they got it. It was
Yep.
the communications, as everyone said, almost has to be tailored to that crowd, if I may, because that's how they communicate. If it's in Spanish or an email or a text or a Zoom, that's my 2 cents.
Okay, thank you. Richard, I know you wanted to add something.
Just quickly, I think we all have a love-hate relationship with Zoom. But if you think about it, what would we have done during this pandemic if we did not have Zoom as a primary tool for communications? I mean, we actually conducted a general membership meeting to approve a merger with the Bronx Manhattan North Association, where we had between 700 and 800 members on a Zoom webinar. I mean, it's amazing how we were able to use that vehicle to really pivot with a lot of our services to our members. But what also came back is good old email. Our open rate for our emails was somewhere in the 10 to 15% range. We do a COVID update every single afternoon that averages about a 35 to 30% open rate every single day.
That's a good average. Folks, let me shift a little bit here, because I think all of us are relieved to know that 2020 will be ending soon, and we're going into 2021. And obviously the vaccine is coming, and we still have to be vigilant and careful, but confidence now is going to be an issue that all of you are going to face in your different sectors and with your clients and your customers. What's the strategy that you and your teams are beginning to look at for 2021 to build that confidence back? And again, I'm going to throw that open to anybody and everybody on the panel.
One thing that all of the discussions, especially the last section, highlights, talking about communication and getting the message out, that also begs the point that you have to have a good control of your data. So you have to know who's in your organization, what are their best contact numbers, their if they have in case of emergency, all of that data, you need to be able to not only collect it, but organize it and access it. And one of Jonathan's first points was about a business continuity plan and how that helped the hospital react. So having a business continuity plan is a great way to build confidence, because that's going to be your roadmap for what happens in case of an emergency. We just lived through an emergency and we had this fire drill, but now formalizing that so that everyone within your organization has the toolkit or the roadmap to say, this is what happens, this is how we return to operations, this is when we stop operations, these are the points of contact, those sort of things you want to have memorialized, and you want to socialize it within your organization so that people are aware of it and can abide by it. And that's one of the ways that you can build confidence in going back to, I hate to say going back to normal, but progressing or shifting.
I think that's a great point for, for your internal communications and your internal operations. And, we talked about that too, how do we make sure we have when at a retail store, you have such high turnover with management staff, it's hard to always know who to get in touch with. So that was one of our key learning points too, is can we set up some kind of portal or something like that so we have constant communications. And I think also from an external point of view, reaching your customers, I think that more than ever, visuals are really helpful for showing your safety measures. I think it's important not just to tell people that it's safe to come back and that people are wearing masks and we're cleaning, but to show people. And using customer testimonials and reviews is more important than ever. So other visitors who haven't been there before or haven't been there in a long time can see how you've made changes. For example, and this is just a minute detail, we have Santa coming to Cross County Center, and Santa sees upwards of 7,500 children a year. So, this season. So, this year it's a big debate. Do we keep the normal factor and do we bring our kids to see Santa? So, from our perspective, we want to show you the set. We want to show you all the safety measures we've taken, not just tell you about it, so you get a better understanding and you feel confident coming.
Yeah, I would chime in and also agree with what both of them said. It's even more of a challenge now because you have to create, I think education and creativity are the two, pivotal points for us in getting the message across. When we educate the people on why are we wearing a mask? You know, why are we carrying sanitizer? Why are we limiting how many people could be in a store or restaurant at a time? You know, just those signs that Liz spoke about, they help with consistent messaging and education. And the creativity side of it, you know, people look forward. You know, it was Jonathan, I think, said earlier, Richard, somebody mentioned about, you know, the St. Patrick's Day. You know, we look forward. That's the first parade of the year, and that usually sets the tone, you know, for the remainder of the year's, you know, parades and events. So, you know, earlier tonight, I just came from what we call a virtual tree lighting, where we literally just, you know, to try to keep that holiday spirit, but we just literally recorded me speaking and recorded us lighting the tree in the dark room at the Paramount, you know. But we still want to convey the message and show people as leaders, like, we're sacrificing our time with our families, you know, we're sacrificing the love and fun around our friends, you know. So as leaders, if we can do it, we can only hope that you can do it. But we're doing it because we want to see 2021 be a lot brighter year. We're doing it because we don't want to see any more of our family and loved ones not be able to join us for the holidays because of somebody else's irresponsibility or lack of care for the possibilities of COVID. So, you know, I agree with what both of them said. You know, getting that message to the people, the core people in your staff, those are the leaders that your customers are going to run to and follow their lead. So I think that's very important, but also trying to be creative for 2021, just in case this doesn't go in our favor.
Joan, I'd like to kind of go back to how you asked the question, though, which is continuing with the vigilance right now. And Mayor, this goes back to what you were just saying. I'm very optimistic about residential real estate going into 2021, but the numbers are scary. The vaccine is not here yet. There are a lot of people acting as though the vaccine is here.
Right.
We've got a lot of work to do before we get into the middle of 2021, and we've got to just keep on hammering home. Wear a mask, wash your hands, don't get into large gatherings.
Mm-hmm.
That's, you know, my concern. My optimism is tinged with concern that we're going to go through a scary period until at least the middle of January, if not the end of January. So we got to keep hammering the message.
Yep.
Yeah,
And the CDC, I think we're seeing more from the CDC now over these last few weeks than we had in the last few months on daily updates, which I think is going to be important, is going to get to the point that many of you have raised in terms of getting that information out and making sure people are again aware of what they need to do to protect themselves and their families and their coworkers. You know, I saying all that, saying that we still don't know 2021 and there's so many unknowns, but we want to talk about what's going to be sustainable in terms of a recovery. So again, for each of your different industries, and Mayor, I know for government, obviously there's a different definition for recovery and sustainability, but for each of your different industries, and I do want to go around the table on this one, and I'll start with Jonathan. What are we looking for in terms of what you think you need to see for a sustainable recovery?
So fortunately, we have some experience already. I mean, in the summer months when it got a little bit better, we did see some level of recovery. You know, the concern, would patients come back to the physician offices? Through our effective communication mechanisms, we were able to convey that, you know, the offices are safe. We've taken every possible measure we can to protect yourself and your family members, and we saw some recovery. So I think we will. I mean, obviously I'm in healthcare, so there's always gonna be need for healthcare, particularly as the population's aging. So utilization is not necessarily gonna be a challenge. It's gonna be, how are people seeking care? What are the methods of care delivery? You know, we went through a virtual health sort of deployment quickly, had no choice, trial by fire. But now we've learned from that. We're going to continue to expand our virtual service offerings because I think digital healthcare is here to stay, not to the levels that we've seen it being utilized right now or even earlier in the spring, but some element or some component of our population will always choose the convenience of digital healthcare. So I think it's just going to evolve how we treat patients, but there's always going to be need to treat patients, and we'll be here to do so and continue providing.
And I'm just sticking on that for a second, Jonathan, because I'm curious in terms of the telehealth or the digital healthcare. I mean, does that also mean now you all have to train some of your folks a different way on how they do their day-to-day operations?
Yeah, absolutely. And, you know, physician preferences do play a role in this as well. We have some doctors who, you know, will intersperse virtual visits with their in-person visits. You have some that prefer to do it as blocks, but it's about how do you increase access? It's more about designing the system around the patients and what they want. The example I use, although not always popular, is, you know, it's sort of like the seamlessization of healthcare, right? I don't have to leave my house now because I get food delivered, I get groceries delivered, I get anything I need from Amazon potentially delivered. Amazon has PillPack, they now deliver medications to your house. So in reality, there is a convenience factor, and it's how do we provide convenient services to our patient population, how they want them, where they want them, and when they want them, which could be at 3 o'clock in the morning. So how do we create a continuum of services that can sort of handle the needs of everyone, because we want to customize and personalize the experience.
Darcia, what are you seeing in that?
Sure. So as Jonathan said, the seamlessization, there are some people in the legal industry who have said the Uberization of legal services. Exactly. Being able to deliver a service that is going to be fast, efficient, where there's transparency in pricing. That's very important on the legal services side. And then the clients I service in the tech industry, they have just been, it's been a boom because everyone needs more tech services. And so it's just about getting the right people in places to support that growth.
Sarah?
Yes, that's okay.
It's different for different aspects of what we do. So for example,
Karen, please.
Peter, I think I need you to go on mute for a second. I'm sorry, Sarah.
That's okay.
Thanks, Peter. Go ahead. I'm sorry.
So brick and mortar retail, I think, is going to continue to evolve. Unfortunately, much of the demand that was filling the traditional retail per se was being filled by experiential retail, right? Entertainment, food and beverage, boutique fitness, and all of that demand has dried up in a time of COVID. But that will return, that'll hopefully that's, June for returning. So I think, that recovery will happen at that point when people are eager to get out and they feel safe getting out. Office is going to take longer. The shakeout's going to take longer. We're going to have to see how many companies shed space and go fully remote, or, shed space and go partially remote. Industrial really never had a huge, kind of downturn. So that remains healthy. And investment sales, it's a mixed bag. As I said before, the development site activity has been robust. And there's going to continue to be a lot of distress as well. So we'll see sales on that side of things too.
And Liz, I know 2021, you're having a new tenant come in that's going to attract a lot of attention. So, which is Target, which is a great boom for Cross County and also for the community surrounding that. So talk to us a little bit about 2021 and some of those priorities.
Sure. Well, thank you. Yes, we're really excited to announce that Target is going to be coming into Cross County. The first Target store in Yonkers. I think it's one of the largest leases that was signed during the pandemic. It's a 40-year lease for over 130,000 square feet. And we're super excited. I mean, Target was one of the most essential retailers serving customers during this time, but I think they're successful because, they serve multiple audiences with multiple uses. And I definitely agree with Sarah, retail was heading towards that experiential line, at top speed. And now that is definitely kind of halted, but I agree, it's only a moment in time, and I think they'll be back too. Now, I think retail locations that have grocery, that have medical, and even office to some extent, I think office will take a little bit more time, as you said, but as you also said, you're in the office every day because you've got to get out, you've got to manage the work remote, the kids learning remote, and, your situation of where you live. So I think office will be back too, but now I think those shopping centers that do have the grocery and the medical, those are kind of where we're headed again. I think the malls that were struggling before are going to struggle. I think it's up to landlords to kind of, help find uses for the empty spaces. And I think from a retailer perspective, they're going to rethink how they use their brick and mortar locations. Do they need all that square footage, or could they change the square footage that they have and help use it for online fulfillment? Curbside pickup, in-store pickup, those are huge trends that I think are here to stay for a little bit longer, at least another year. So, you can use your brick and mortar to convert some of that space, to manage your inventory and manage your staff. You're going to change your staffing, you're going to change your operations, but I think you still need to keep your brick and mortar because Americans cannot live without this social experience for very long. It's in our blood. It's what we need. So yes, you can get everything you want from Amazon except for friendship and socialization.
And Richard, you have a unique perspective because you're not only are you in the Westchester region, but you're all over the Hudson Valley. You're also in New York City and now Long Island. I mean, are you seeing different trends that might be happening in one area that Westchester could be experiencing in 2021?
I think throughout the suburban area, 2021 is going to be very bullish. I mean, home has taken on a whole new meaning with COVID. and especially single family homes. I mean, condos and co-ops have been flat. People are not trying to get out of the city from their condo or co-op in the city to buy one in White Plains. You know, they're looking for single family homes right now. So I'm really bullish for 2021. I think the trend is going to continue. It really, though, is going to hinge on what Sarah was talking about. I live in New York City. New York City's economy drives the New York State economy. What happens if all that commercial space stays vacant and you don't have commuters coming in and out of the city supporting the economy? And that's going to be a huge factor on this sustainability, I think, of all of our different segments of the economy going forward. I'm still optimistic. I think, quite frankly, if we have a vaccine in place by the summer of 2021, people want to go back to their quote unquote normal lives. They want to go back to Peter's restaurants. They want to go back to the shopping centers. But it's going to be a challenge in terms of how the economic recovery plays into this.
Mm-hmm. And Mayor Rainey, as you're walking the streets of your city and your constituents are coming to you looking for a guidance of what 2021 will look like, what's your message to them?
Yeah, fortunately, the City of Peekskill was one of the recipients of the DRI grant last year. And we were hoping to implement some of the changes 2020, but because of COVID, we had to push it back. Hopefully 2020 is a year that we can, start preparing for that. And it was a $10 million grant just to revitalize our downtown area. Collectively, last year, we got about $16 million in different grants for different projects in the community, from the downtown and on the riverfront park. So, I tell them, in all of this, once we're back to moving, we're going to be able to hit the ground running. We have a lot to look forward to. But the important thing for me is to, advocate for the businesses, try to advocate for the state and the federal government to get the resources that they need to get back on their feet. One of the things that I personally push now, just because of my own fears of what I've seen is, how do we, find ways to create an opportunity for, pretty much, mental health. I think that once this is all done, there's going to be a lot of different challenges from everyone, business owners, elected officials, even, just families as a whole, school, teachers, students. I want to make sure that we don't just reopen and people just go crazy, because I think after the reopening process back in early August, look where it's at. Look where it's gotten us now. Like, we reopened some things slowly, and people were just so stressed and so tired of being trapped in their house that they're at the point now. What we're finding out in the local level as a government is people are just gathering together because they're just tired of being home. I had to shut down Halloween parties, Friday night barbecues, volleyball tournaments. There's a lot because people are so stressed out. So we're looking at tapping into somewhere in the city budget, or hopefully we could put some sort of mental health assistance, or even just collaborate with the mental health organizations like Andrus and others around the area to prepare people for reopening once we do reopen. And last but not least, just creative ways of operation. The new normal may not be the normal that we're used to, but it could be a new normal that we get used to. If it's going to be safe and effective, keep us alive together, then we'll have to do that. Some stores are doing a lot more of carry out, delivery options, sanitizing on the way to and from, and the delivery. Like, there's so many creative ways that we can prepare ourselves for next year. And again, a lot of it takes the city leadership to show that we're doing it. When you come to City Hall, you have to take a temperature. You have to sign the paperwork, the COVID safe paperwork. You have to get, you have to set up an appointment before you come. We don't want 15 people in the office at one time. Like, we're showing this by leading by example, hoping that those who trust in us as government and those who follow us will do the same.
That's great. And Peter, I know you've talked about, again, your industry being in the crosshairs, and 2020 obviously there's still so many unknowns. What are you looking at in terms of expectations for, again, moving the hospitality industry is so important to Westchester County because of the number of people they employ. What are you looking for in 2021? Oh, you're on mute, Peter. You're still on mute. There you go.
What am I doing? There we go.
There you go.
Now I'm on mute when I don't need to be on mute. Sorry about that before. I think 2021 is going to be a challenging year for a lot of us in the business. in the hospitality industry. It all depends on the communications. We were actually doing well in September, October, November was coming around. I got to tell you, we hit a brick wall going 35 miles an hour. I know it's not fast, but when everybody got very nervous in November, the second wave's coming, we saw our to-go business, which has our curbside to-go business, no contact, shrink by 50%. So it sounds like we're getting better at communicating. It sounds like we're getting a little more consolidated in our views, what is appropriate, depending on how the vaccine comes out and the therapeutic drugs come out. People are still scared. They're still scared with the misinformation that is out there. It still amazes me, the conversations that we're all having about masks and 6 feet. In our restaurant, we're not 6 feet. We are 6 feet apart from each other outdoors. Indoors, we're 10 to 12 feet. I think it's good. I think we know what we're getting into. I think the hospitality industry has rebounded somewhat and is stabilized. The ones that are either zombies, half alive, half dead, we're still half alive. The places that have closed and have not opened up, I think it's going to be very tough on the landlords. I think it's going to be very tough on a lot of restaurants out there. I do see business somewhat pivoting and becoming more curbside, more family meals, more spread apart in restaurants. I don't think 6 feet is enough space mentally, but it's funny. You drive by taverns and bars after you have a couple drinks and after 10 o'clock, it's amazing. The governor even admits it, that, people are hugging and kissing after 2 or 3 drinks late at night. Hey, what it is to be 21 years old again. But I do see a stabilizing, and I am cautiously optimistic. Now, if I may, what I think is going to be phenomenal is 2022. I think it's going to be the roaring 20s, just like 1920, the roaring 20s. I think 2022, when the economy is strong and we've been medically safe, if I may, if no one jumps on me too bad, we've been medically safe for 6 to 12 months. I think 2022 is going to be crazy.
I think you just named our campaigns for 2022.
There you go. And look, again, Westchester County will be in a better position because we have leaders like you in your different industries who have not folded up their tents and gone home, but have kept moving forward. And that's what makes Westchester special. And that's what makes the fact that when we do get out of this pandemic and move forward, as Peter said, in 2021, 2022, it's because of the work that all of you do. So I want to thank all of you for being part of this discussion today, our panel. I want to thank Joe McCoy, the Senior VP of Commercial Lending and the Region Manager for People's United, for this series that we've done throughout the course of 2020, pre-pandemic and post-pandemic. And for those of you who watch today and you'd like to share this with colleagues and friends, this will be on our website in our resource center at www.thebcw.org. On behalf of Dr. Marsha Gordon, our President and CEO, and Heidi Davidson, our board chair, and the staff at the BCW, we want to wish all of you a happy, healthy, and safe holiday season. Let's get through 2020 and move working together in 2021. And again, the confidence that Westchester should have because of leaders like you will help us do that. Everyone have a good night.
Thank you. Happy holidays.
Be safe, everybody.
Happy
Thank you.
holidays,
Safe.
everyone. Good night.
Thanks, John.
Happy holidays.